Inner Voice, a heartfelt chat with Dr. Foojan.
Break free from the forces holding you back. Get the life you deserve. Eliminate stress, reduce anxiety, decrease depression, and start living your full potential. Thousands have used Dr. Foojan Zane's awareness integration theory, an evidence-based behavioral health breakthrough with incredible life-changing results. Getting rid of past trauma, having fulfilling relationships, increasing earnings, and living their best life. Now, the Foojan app is available to everyone. The app is Dr. Foojan Zane's awareness integration theory in the palm of your hand. Download the Foojan app today.
Hello, everyone. Welcome to the Inner Voice podcast, a heartfelt chat with my guests and you beautiful listeners and viewers. I'm Dr. Foojan Zane. I'm a psychotherapist and author and the originator of the awareness integration theory. It is so great to be with all of you. In this episode, I chat with Dr. Ioan Hanes. He is one of the pioneers in the field of lifestyle medicine in Europe since 2018. Dr. Hanes has been a board member and a vice chairman of the European Lifestyle Medicine Organization. He's also the founder of the Belgian Lifestyle Medicine Organization, which together with Elmo led to a joint action for the development of the first European Lifestyle Medicine Certificate, Health and Fitness Lifestyle Advisor. The certificate he developed and coordinated has trained more than 350 health professionals from Europe and around the world to acquire and practical skills to prevent and treat lifestyle-related chronic diseases. Since 2019, Dr. Hanes has been the organizer and the member of the scientific committee of ELMO Congress. He is the coordinator and author for the first European ebook on lifestyle medicine and chronic diseases, prevention and treatment. He coordinates the sexual health and lifestyle medicine module in the first European Lifestyle Medicine University of Thessaly, Greece. He is trained in lifestyle medicine at Harvard University in Boston and is motivational interviewing at Massachusetts University Hospital. In Belgium, he is certified as a clinical sexologist and ULB in Belgium and graduated from a master's degree in human sexuality and family studies in Belgium. He's also the member of Société Belge, the Médecins Nutritionistes, and graduated with a master's degree in food science and nutrition at Ghent University. He speaks 5 languages fluently: English, French, Dutch, Romanian, and Hungarian. He works as a nutritionist in the Obesity department at the military hospital in Brussels in Belgium. He's also the medical expertise doctor for various governmental agencies. As you can see, he is an amazing expert in this area. I met him at, he was a lecturer in the course Lifestyle Medicine, which I got in Harvard. And I met him there and I requested for him to be, to have a conversation about sexual health. I truly enjoy and learn a lot from him. And I hope that you learn as much as I do. So our conversation is about sexual health. Subscribe to my podcast, my YouTube channel, and connect with me through my website at foojanzane.com or any of my social medias and share with me your thought. I'd love to hear from you. So without any further ado, here is Dr. Ioan Hanes.
Eliminate stress, reduce anxiety, and decrease depression. Dr. Foojan Zane's awareness integration theory has helped thousands like you get incredible life-changing results. The Foojan app gives you her evidence-based treatment in the palm of your hand. Download today.
Dr. Ioan Hanes, it is such a great pleasure and honor to have you with me on this show. Thank you for joining me from you've been all over the world and back. So thank you.
Thank you for the invitation. It's really a pleasure to be here.
I had the privilege of meeting you actually since I'm taking a course with Dr. Freitas at Harvard, and you were one of the presenters, and I enjoyed your conversation so much that I connected with you, and I asked if we could have this conversation for my audience in the podcast, and you graciously accepted. And the topic is sexual health, and it's an interesting conversation when we talk about it from a sexual health perspective, because as a psychotherapist, I work with a lot of clients, and also with a lot of couples, which come into my office. And sexuality is something that people are not that free to talk about. It's one of those concepts where there is so much stigma around it when it comes to experience, when it comes to feelings, when it comes to sharing. And it's so attached somehow to people's self-esteem. It's almost like couples don't talk about it. If they're not satisfied with it within their own system or other people, they feel like embarrassed and shamed to talk about it even with each other. And, although it might be a humorous conversation among friends, but when it's a serious conversation, people don't really want to share. And it's one of those things that somehow there's an expectation as if we were born, we should be skilled already. And that's not the truth. It's a skill like anything else in the world, where as we grow up, we have to learn what makes it to be healthy, what makes it to be dysfunctional, what makes it, what are the things that we need to learn to take care of ourselves and to take care of our relationships. So it's one of those topics that everybody has some like horror or giggling behind the scenes, but it's so hard for people to talk about. So I'm grateful for us to have the opportunity to talk about this.
I thank you again, especially because it's not easy and requires a lot of courage to discuss about that. But you mentioned some items which actually make us to be able or not to discuss about sexual health, and this is what was introduced in the years 70s by Simon and Gagnon, who approach sexual health through the so-called sexual script. So the way how we relate to positive sexuality, so sexual health topics, it's really much influenced by our education and the culture in which we live. So this is why if we had an education, or we lived, or we live still now in a traditional or a society where we don't discuss about that, we will not discuss with our patient, with our clients about these aspects. And it's also that until a few years ago, the only one thing about sexual health was the unwanted pregnancies and the sexual transmitted diseases. But luckily, we had the World Health Organization statement, which changed everything.
Yes. And you have in the chapter of the book that you have contributed to, you shared that actually. And what I say, the World Health Organization says sexual health is a state of physical, emotional, mental, and social well-being, and not merely the absence of disease, function, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experience free of coercion, discrimination, and violence. But you also suggest different types of references for sexuality, such as sexual satisfaction in your chapter, or sexual pleasure, sexual self-esteem, and sexual self-efficacy. Could you share a little bit about that?
So I always say to my patient and clients that sexuality is not a charity. So before knowing what we expect from other people, I mean, in couple or whatever it's the form that we choose, we have to know ourselves what we like. So. And here we talk about the sexual pleasure, the sexual efficacy, so means that you know what you are looking for, sexual comfort. So these terms are helping us, and this is most of the time starting from early age through education, what we need, how we live our sexuality, and we are going for that. And when we know what we like, what we go for it, we have also a safer and a healthier sexuality. So that would be really, in a few words, all these concepts which could be a bit confusing at the beginning. So
what becomes the conversation of health? It seems like as we develop, as you share, the concepts that our family tells us, we learn through the culture and how our family talks about sexuality. Then I think that we learn it also from our kind of peers, because sometimes the messages that our families tell us is different than as an adolescent, let's say, we learn from our peers at school. And it's different than the sexual education they give us at school, where the sexual education at school is usually about how not to get the sexual diseases and, to prevent pregnancy. But the sexual education that kind of we get from our peers, and sometimes just through pornography based on the cell phones that we have. And then they start with sometimes a pleasure or a coercion based on the years that we are in high school, or even, now like junior high years, which gives the people a different understanding. And sometimes it's a very different message than what they get from their culture. And there's a duality that happens inside a person as they come, as they're growing up into this world. And then it seems like it's very much attached to their self-esteem somehow, whether they're attractive enough or whether they can perform enough. And their performance and the skill building gives a lot of, self-esteem issues at that moment, especially as they're growing up from, let's say, an adolescent to an adulthood. And sometimes they feel pressured and they put other associations around sexuality. So can you share a little bit about all of this and how this affects the sexual health?
So it was still a bit linked to, related to what we discussed first. So was a study which I give this example often, was performed a few years ago in Sweden with Iranian immigrants who arrive in Sweden. So, and then they've been interviewed, what do you think about divorce, about sex outside of marriage, LGBT community. So all those questions which could be challenging. And of course, the answers were a bit reflecting the tradition, the education, what they had before they arrived to Sweden. And then they asked the same questions 10 years later to the same participants. Of course, after living in a society as Sweden, the answers were mostly different to what they replied 10 years ago. But when they replied, were in Swedish and not in their native language. So even if you change your opinion, it's so strong, your roots about how you've been educated. Now, of course, when we talk about education related to sexual health, it's not only in Iran or other countries that are challenging. You have a lot. For example, here in Belgium, where I'm living, a few weeks ago, they introduced some new curricula in sexual health. And some schools, they put fire on those schools where you dared to challenge the classical views on sexual health. So it's a topic where in many, many countries around the world still starts a very, very passionate debates. Now there is also a reality. For example, in France, half of the teenagers, between 13 and 15 years old, they've been in contact with pornography. So this is why I consider personally that having a structured, safe education about sexual health is definitely influencing how people will refer to their body. So there it's an important part, how I feel comfortable in my body, how I, for example, often teenagers feel that, yeah, for example, a breast is bigger than another one. It's totally normal, or a testicle or something. So these are something which we learn in an education which is made scientifically and in a safe environment, and not to refer ourselves through the eyes of pornography when we talk about so early age.
Very much. I think that the education that a lot of the teenagers get is either through experience or peer pressure, or what they learn from somebody who's at their own age, or through pornography. And part of what becomes important is, as I hear you and see it in your book, it's more about how do I learn how to first take care of myself and my body, whether it is what I like and what I don't like, and what works for me and what doesn't work for me. And that comes into comfort, safety, and pleasure first, and then skill building, which then it's the concept of then beside me, then how do I connect with another human being? Because we also see, because of the world of pornography, that a lot of people start getting very private and personal with themselves, and through masturbation and through pornography. And then it is hard for them to relate to another human being. So in order for them to have bring their sexual health and information and skill into a relationship, which at one point they get into. Do you have any studies or conversations and tips that you want to share with people in not only how to take care of themselves, but how to relate this into their relationship?
Now, when we talk about teenagers, there are very good shows. So was one very popular on Netflix, which really it's not even for teenagers, but even for adults, which you probably know about, that was very, in a funny way, very informative way. So I strongly recommend that, Sex Education. Now, when we talk about pornography, the industry really adapted to everybody. So today you have stories, or you have a pornography story, a narrative, which was actually built up for women. So you feel in a way that it's something more than just often the very aggressive and very degrading attitude how women are treated in most of the pornography. And that is not sex. So that is what we see there. That is very, very important. We cannot change that. So whatever we do, pornography exists, and will exist. But it's very important to be aware that sizes, performance, these are all artificial, what is there. So that is not the real life. Now, of course, sometimes we recommend certain type of pornography for those, for example, to explore who they have problems with identifying their fantasies. Because I was formed with according to a Canadian school of sex analysis, and there they consider to have an balanced sexual health. It's about knowing what turns you on, so your fantasies, having a knowledge about your body. So masturbation can help to identify your pleasures, and then to share with someone else your intimacy also through a sexual activity. So I would say that my view on the pornography, it's like everything when we talk about emotions, about instincts, it's measure. So it's adapted to a certain age, to a certain experience, or eventually for a certain purpose, but definitely not to be the first contact about intimacy for teenagers.
You also talked about in the book, you also talk about the lifestyle influencers, right? Like risk and different types of treatment factors. You talk about major ones being age, sleep, chronic heart disease, nutrition, exercise, diversity, stress, addiction, and different types of medication, which might interfere with your sexual health or change, not even like the interference might be normal, and the education that we get about it will allow us to know, how they adapt. So for example, for age, they might be differences, and each one of the differences in different types of age, it might be natural for that age. But if we don't know about it, we might take it as if it's not the natural progression. Can you share a little bit about these influences, lifestyle influencers that would be affecting our sexual health?
At least here in Brussels, where I'm living, so I follow 3 years post-university training to become a sexologist, a clinical sexologist. In those 3 years, we didn't discuss maybe 1 or 2 hours of the lifestyle. So, you take out the sexuality of someone, like it's not influenced in which environment or which, health or how your body and etc. you have. So I was very disappointed. And then I arrived in the field of lifestyle medicine. I've been with the same excellent professor, Bert Freitas, and we did a course about lifestyle medicine, and was not discussed so sexual health. It was like intimacy, love, relation, which are important indeed, but we have sometimes to name the concepts, to name the reality. So I was second time disappointed. So I said, what I will do here? So I said, if something doesn't exist, let's invent it. So then I looked at the literature and I tried to make a puzzle about how our lifestyle factors actually say a lot, but can also influence sexual health. And here, one of the things, still a bit related to pornography and what you mentioned, is that we have young male patients of 20 years, between 20 and 30 years, 20%, they experience the most common male sexual dysfunction, impotence, as was called in past, but now we call erectile dysfunction. Of course, there the main cause is pornography, excessive pornography. For someone of 40, 50 years, and there we have a percentage of almost half of the men who experience erectile dysfunction. There it's organic, could be cardiovascular causes. So we can see that actually age or health, cardiovascular things, could be viewed or could be influenced by sexual preferences or sexual health. Now, today we live in what someone saying in an obesity and how it was that called, an epidemic of obesity was a very special word there. So that influence testosterone level, influence pleasure level, influence libido. So this is why today, and we live in also a very stressful world. So this is why today 60% of the couples who are experiencing, young couples, they are totally healthy, and they cannot conceive. So they really faces fertility issues, and 60% of them, especially male men, are the cause. It's chronic stress. So it is something what it's working on. Diversity. So here we have the LGBTQ plus community. So for example, we have the concept of minority stress. So being from early age under the influence of being harassed at school or church or home, that really develop in you a certain risk-seeking attitude with all the consequences which can be there. And then maybe even easier today, and can be implemented by everybody, which type of medication we take. So often medication against depression, so the SSRI, which is a first-line medication, it seems 3 or 4 years that it's mentioned that this medication, even if you stop it, can still cause sexual dysfunction in men and even genital numbness. Or often medication against high blood pressure or certain antibiotics. So it's very important when we prescribe a medication to look there or to discuss with our patient that, look, this medication can influence your sexuality, sexual life. Is it something that it's important for you or not? Because, of course, we have to do, like health professionals, we have to do a decision. But definitely we have to discuss more about the lifestyle factors of the person in front of us.
So when we're talking about the lifestyle, it seems like there's also a bit of uncomfortableness and shame that shows up when I've worked with men, where there's a denial that shows up for them when there's an issue about the erectile dysfunction. Because they're so culturally, even since about high school, they've been taught that they have to be the stallion, they have to perform, they have to do everything. If they're going to be their manhood almost is attached to this concept of performing well under all the stress. When they are having some issues, I've noticed that there's a lot of pain, and due to that pain there's a denial, and they keep pushing it away, and they think maybe it's because of the partner itself, and they'll come up with different types of justifications around it, which takes them away from actually going and getting appropriate treatment for it. What are some of the what would you say to someone who is afraid of this matter, so they push it away instead of going and getting treated for it?
First time when I started to discuss about this topic was in a European Congress of Lifestyle Medicine, and then I challenged the audience. I said, who from the audience can say that even once in their lives they had an erection problem? Raise your hand. First was nobody. And then I put my hand up, and then were many other hands. So almost every man will experience in one moment of their life, for different reasons, erection problems. So that is, would say, normal. Now, if we experience that more than 6 months regularly, there we arrive to what we call a erectile dysfunction. But even in that moment, we cannot say that we have a problem, because the definition of a dysfunction is actually when it causes pain to the person or in couple. So this is why when I discuss about lifestyle, so I work most of the time with people with obesity or with people with metabolic syndrome, if not just only sexual problems. But even in a consultation, a general medicine consultation, of course, I'm not starting with this question. So in the middle of the conversation, I ask them, look, your medical condition can influence your sexual health. Is it something related to your erection or libido, being the most frequent in men, or in women, your libido or dyspareunia, so pain during sexual intercourse, which bothers you, or you would like to talk about that? And then 1 person in 4 will like to go deeper to discuss that. So it's a very, I consider it a very polite, very respectful way to bring in conversation something, as you said, often cause really a lot of sufferance in a couple, when a simple lifestyle modification or medication or local treatment can really solve the symptoms. Then the problem we will explore later with the person. There's
also behavioral skills that are given to support and teach, a lot of times coming from someone who has gotten erectile dysfunction because of pornography, and they've kind of created their body to be used to a certain type of performance, and then they would have to use other behavioral methods in order to shift, whether it's erectile dysfunction or premature ejaculation or any of them. So there also isn't, beside medication if needed, but it seems like there's also a lot of skill building, shifting behavioral exercises in order to gain the optimum level of, let's say, pleasure or optimum health. Can you share a little bit about that?
Of course, I consider that, and when we discuss, the first step is to degenitalize sexuality. So sexuality, sexual life is not only about penetration. So that is something important to ask. And of course, when you have 20, you have a certain type of sexuality. When you are at 40 is different, or when you are at 60, 70, because we have seniors sexuality. So I try to integrate this in intimacy, because I mean, you, from your work, maybe it's also very known, but from my professional experience, many people stay together even if they don't have sexual life, because there's other ways how they can relate in intimacy. But for those who it's really important, and it's part of to feel good. And here I always share with, especially when they are coming in couple, that for a woman saying that, I don't want my partner, husband, to take medication. And I say, look, as for a woman, breast, it's most of the time a sign of femininity. An erection for a man, it's also something which affirms their sexuality. So let's see what we can do here. And one of the topic, it's something, one of the tool, it's the sensate focus. So it's coming from Master and Johnson, where you have exercise. You have different forms that the essence is, for example, it's the first week. One of the partner is preparing the place for a massage with candles, with music, and it's offering massage to the another one, but no genital touching. The next week, they change roles. The second part, so third and fourth weeks, they can eventually touch genitals, but no sexual contact. And then the last time they can have a sexual intimacy. It's a way to, as I mentioned, degenitalize sexuality and to explore the bodies, what the others, they can discuss eventually, especially in the third and fourth week, what is your experience, how you felt, because communication is essential. And why you should be in a couple with someone who you don't even trust to say what you like and what you dislike. So replying to your question, I think communication is essential to say, this is what I like, this is what I don't like. But if we have a couple where both of them, it's what we call sexophile. So people who like to explore sexuality, who like to discover more about their sexuality with their partner. Because we can have also, as we have people who don't like alcohol or people who don't like to smoke, is the same also with sexuality. There are people who don't like sex. And we have more and more now the younger generation. I think I had also in the course some question, am I not normal if I don't like sex? No, this is your way to be. It's totally okay. The problem is when someone who likes sex gets in a couple with someone who doesn't like sex. There it's something to be changed.
I really like what your conversation about communication, because I also have noticed a lot of times with couples, even with, and I'm not saying that all women or all men think of it this way, but you talked about stress. And one of the things that I also notice is, especially when couples have children, their sex life changes because of adding stress and having children being at home, sometimes being in their bed, sometimes, having to shift all of it, and then being tired. So not only like as a couple, as a younger couple who don't have children, they come from work, they have the ability and the time to kind of de-stress by exercising or zoning out and coming back together, and there's a time that they could connect emotionally together, and that builds the intimacy as they go, maybe possibly have a sexual act or not, but their sexuality becomes part of this. Even it becomes part of their touch, whether they, it leads to intercourse or not. But when we add the concept of family system and the stress of children, I've noticed a lot that it affects, like what you said in the book about the environment and the stress, it affects both. In even having the desire to even be connect, it's almost like, let me just do what I have to do during the day and then collapse. And sometimes with men, they utilize the sexuality as more like a connection and releasing of the stress. While a lot of times women, they need to actually completely zone out, have their body very relaxed before they could even entertain, some type of a touch even. And like you said, communication in between becomes so crucial, because sometimes they feel rejected because they go toward each other and they're not in the space to be able to receive. But then that is taken as if it's a rejection, and they feel hurt by each other, and it actually takes them, and they're no longer close, and they don't want to talk about this. It becomes one of those issues of not conversation. And even if they're conversing about it, it's coming from like anger and frustration about it. So they'll have the like microaggression communication coming at each other, which takes them away. And then something that they really need to be close, it just evaporates because of some of these things. So bringing back, like safe communication about these matters brings couples back together and brings that type of like allowance of pleasure. Plus that maybe when they got together, their body was acting differently. The stress of life was different. And as they go through couplehood with all of these other like career stress, child parenting stresses and all of that, and age, their body changes. And because the communication isn't ongoing and they don't know how to share with the other person, I think as their relationship changes, the communication might stop. And therefore, they don't share with each other what they need. Sometimes they don't even know what their body needs anymore because they're not even tuning in to see, and they're expecting themselves to perform at a, single 20-year-old versus someone with a high career stress, parenting issues, and age developing and moving forward. And plus women adding the concept of hormonal issues into it. So like you said, the communication is the key, really.
Indeed. But here what I often suggest is that as we find time to do physical activity, to go to buy healthy food, we have to find also time for our couples. So that means that before being a mother, before being having a career or a wife or whatever, we are we. So what is your me time? So that is one thing, because someone who is all the time available definitely could be the best person. We need always to keep a certain sparkling in the couple. So I can have something which I enjoy, it's me time, and children, partner has to understand that. And then you have when I am your partner. So of course, it's not possible with the crazy world of today to have every day or every week, but at least one per month, we are going out or do something together which we enjoyed. And if we forgot, or just go back when you just met, what you enjoy to do together, and find time. find time. It's actually the priority. What is really priority? Because as you take care of your body, your health, you have to take care also of your intimacy. So that is something what we unfortunately we have to integrate, to plan if we want to keep the fire there in our couple.
Mm-hmm. And I also, as we close down, to also look at the meaning that we have associated with sexuality in a sense, because as we age, as the circumstances change, somehow the meaning that maybe our culture gave us, like you shared before, or whether as a youth, we were expecting ourselves to have. And I think the education that we allow ourselves to keep getting around these areas will also change some of the definitions and associations that we might have given who we are, our identity, and sexuality together. And maybe we could shift those in a way that works for us, and it doesn't create suffering and pain. Whether it's the knowledge of my body has changed organically, or it's the environment that has changed, or that I had some fantasy in my brain and knew it, that fantasy, but then in real life I see that it's not working. So I gotta, I gotta accept the reality and what's best. So that type of coming to acceptance of who I am, where I am, and how can I make this work for me, I think is also one of the things that I really got from your chapter in the book and what you share. So just to share with people, this is the book, Lifestyle Medicine and Chronic Disease Prevention and Treatment. And Dr. Ioan Hanes has an amazing chapter in there which talks about lifestyle medicine and sexual health. In 1 minute, is there anything we haven't really touched upon that you want people to know about this matter?
I mean, I like how you synthesized actually that during years, during experience, how we change, how we integrate in our life. And this is why, for me, sexual health should be just a chapter as other chapters in our life. So we should, how can I say this? We should democratize this. So we should, through communication, through a respectful, so I'm respecting your culture, I respect your education, but I want to give you the opportunity to discuss if you have something related to that, whatever that will be. So let's not make it something which it's actually all the life around that. It's just a part of our life that we should integrate and we should be able to discuss. I mean, if you look back 100 years ago, we didn't talk about physical activity. Today, we don't even imagine that we don't talk about that. So let's make it in a very respectful way also sexual health part of our lifestyle discussions.
Beautiful. Thank you so much for taking the time to be with us.
Thank you very much for the invitation.
And for all of you who are out there, create an amazing life for yourself and everyone around you. And until next week, bye-bye.
Eliminate stress, reduce anxiety, and decrease depression. Dr. Foojan Zane's awareness integration theory has helped thousands like you get incredible life-changing results. The Foojan app gives you her evidence-based treatment in the palm of your hand. Download today.